All right, everyone, welcome back. Dr. Watson is joining me in studio after being in Texas for a little bit.
Oh, it was great.
So, Dr. Watson, before we went to break, we heard two stories that talked about the importance of the mother's health that affects the baby, and also the importance of a father's health before and after pregnancy. And while we always, want a baby to be healthy and happy, that's not always the case. And in particular, is there anything specific you see in your office that affects a child that relates directly back to poor prenatal health?
Well, this could be a long talk.
I know, that was a long spill right there.
There's a long, so some of the more common things that come to mind. Poor maternal health can lead to low birth weights in children. It can lead to premature births.
Okay, yes, which is a big thing.
It's a big thing. If a mother, as she progresses through a pregnancy, starts having problems with her ability to process sugar, so you get what's called gestational diabetes.
Yeah.
So that leads to big babies, which can then lead to problems giving birth and increased risks of circumcisions, C-sections, or can lead to difficulties with birth trauma to the baby. Diabetic or babies born to diabetic mothers can be, they can have poor tone and respiratory problems and can end up in neonatal ICUs because they're not ready to be here yet.
Gotcha.
So those are some of the top things that come to mind.
Now, whenever you have a premature baby come into your clinic, they've been out kind of in the world at that point. What are typical things that you might have to do extra to ensure that child is, okay and hitting the marks of them being premature?
The biggest thing is feeding and growth.
Okay.
A little baby, you want them to grow and kind of do some catch-up growth and get up to where their peers are. And so if they're extremely premature, then there are things that may have to be done from a special situation, including feeding.
Okay.
Smaller babies can have problems regulating their body temperature.
Okay.
So they can actually overheat or get cold quicker than a baby.
I didn't know that. Okay.
And so colder weather, you have to make sure they're warm, and hot weather, you have to make sure they're not excessively hot. But you have to monitor their body temperature, their feeding, their growth, those types of things.
And does poor prenatal health, like I know we're talking about babies, but can that impact a child's entire life potentially?
I would say that there's probably some risk there. If the baby has problems developmentally during the mother's pregnancy, it can lead to potential for cognitive and developmental delays. So down the road, there could be learning disorders, difficulties in those types of things. So it's not just the things right after birth. It can affect the child down the road from a developmental standpoint.
That's interesting. And, I feel like you always hear when, women find out that they're pregnant, just the importance of that prenatal health and following the doctor's instructions. And you definitely talked about that right here. So guys, stick around. We're going to talk about, if you have a healthy baby, some things that you still may experience as a parent or any sicknesses. We'll be right back. All right, everyone. So before we went to break, Dr. Watson and I were talking about poor prenatal health having an effect on a child. Well, let's say the baby is here, Dr. Watson. Everything is fine. Everything checks out pretty normal. The mother had good prenatal health. Are there any common issues you see in newborns or infants that are not necessarily related to poor prenatal health, like maybe colic or reflux issues or digestive issues?
I always tell my parents, one of the big questions right after the baby's born is not the babies. A lot of times they feed and they spit up. Babies spit up. It's part of life.
Okay.
But I always tell parents, this baby has been getting everything from you from 9 months. Nothing has been going through this baby's mouth, and it takes some time for feeding and the digestive system of the baby to really start working efficiently.
Okay.
And
that
so
makes sense.
Questions with difficulties of feeding or how often the baby's going to the bathroom, those are common things right after birth. Newborns typically have a little bit of jaundice.
Oh, okay. With the skin discoloration?
With the skin turning yellow, it's a very normal process. Yes, the level can get a little bit high, and we worry about the baby getting sick if it gets too high. So that's something we may monitor in the hospital. Colic is something. I have 3 kids. One of my children had colic. I tell him all the time he's lucky he has a brother and a sister because his colic was so bad I almost didn't have children.
Okay, so explain what colic is, because I've heard of it before, but it's when a baby just cries all the time, correct?
Right. Here's what I have read.
Okay.
The exact cause is not known.
Oh, that's a little nerve-wracking.
Not all babies do it,
Okay.
but some do.
Yeah.
And yes, they scream. Mm-hmm.
It'll test your patience.
For hours. And I think the official definition of colic is 3 episodes per week of a baby crying 3 hours per night.
Wow.
With no kind of identifiable cause. They just start crying. And it's like clockwork. They do it typically the same time every day.
Okay.
My son, 5 p.m. Till 7 p.m., he cried. At 7 p.m., he stopped.
Okay.
In between, very little help. They just cry, they scream. There's a lot of kind of home remedies, and there's things you can try, but there's no just cure for colic.
Yeah.
But yes, babies do it a lot.
So with your son, and when you see your patients, what is the number one thing you can suggest to them?
There is typically something you will find that will soothe the baby.
Okay.
For my son, it was being in his car seat,
Very
being in a car,
Very specific.
riding around. Like if you were in the car. So
Okay.
when my son was a baby, at 5 p.m. every day, I got in my car. I lived in Lubbock, Texas, and I was going to medical school.
Very nice.
And for 2 hours, I would get on the loop. There was a highway around Lubbock that took 30 minutes to go around. Lubbock, because Lubbock was a bigger town. And I'd make 4 laps. It was 2 hours. I'd make 4 laps, and then I could exit off and go to our apartment, and he was fine. But if you didn't do that, he cried for 2 hours. I've heard parents say that when they turn their vacuum cleaner on, the sound of the vacuum calms them.
So it's really nothing to do with the parent or anything. It's just your
and
baby.
It's nothing specific. It's what works for the baby.
Okay. And then what about fevers? Would this tie into, they're new to the world, they're just getting used to everything? I know some babies tend to, I feel like, run more fevers than others.
So fever is probably a whole separate, that might be a good topic we could do. It depends upon the age of the infant.
Okay.
A newborn baby, which by definition is less than 28 days old.
Okay.
That baby, if they spike a fever, they are hospitalized.
Gotcha.
And an entire infection workup is performed. Blood tests, spinal taps, antibiotics for a minimum of 48 hours to rule out sepsis. Because an infant, a newborn, can be septic very easily. So that baby is put in the hospital, no questions asked. Beyond the newborn period, then the fever, it depends upon, at that point, how old the baby is, the symptoms, any exposures. And so treatments would vary.
All right, Dr. Watson, all good information, guys. That's all the time we have. We'll be back after the break.